My current role is Chief Nursing Officer. Of course, I didn't start out in that role. Years ago, I graduated from nursing school, and this is my home. This is my first job. And so after about 15 years, I became a director, and I was the director of 2 Central, which is a location here, a med-surg floor here at our facility that was named 2 Central just because it was on the 2nd floor. So then after probably about 12 years in on that, in 2015, we started to develop the Orthopedic Center, and I took over as the director of the Orthopedic Center in 2015 when it was developed.
My name is Mary Drew Johnson, and I am the Orthopedic Director here at Baldwin Health. When we started back in 2015, I was clinical educator for the facility. So we opened up a 15-bed unit over in the original hospital that was called 2 Central. We labeled it the Orthopedic Center, and we tried to dedicate at least 12 of those beds, and it was very hard in the beginning because we had 2 med-surg units, and that was one of them. So we had to kind of wire everybody's thinking when we were admitting patients to admit only orthopedics to that one floor, because the whole process was to get a very streamlined admission process for our nurses.
Sure, I'm Mike Blackmer, I'm an orthopedic surgeon. I'm a fellowship-trained joint replacement specialist. I completed my fellowship training in adult reconstruction at the University of Chicago. I work for the orthopedic group here in Baldwin County. Orthopedics is a field that's dedicated to improving quality of life, not necessarily quantity of life. So I specifically chose Baldwin County and Baldwin Health because it's very similar to how I grew up in Tampa Bay, and I saw a community that was rapidly growing, needed subspecialty care, and somewhere that I could grow with the community. We have a lot of people moving to Baldwin County from all over the country trying to get to a outdoors place, a place where we can enjoy the community, enjoy the water, the beach, and the Gulf. Especially in our retirement ages. We now have a facility that can support those patients, and these surgeries and our care at this hospital is specifically targeted to keeping people moving and keeping people able to enjoy the quality of life that they're hoping to achieve in their later years. And it kind of goes hand in hand with living at the beach and or living near the water and being able to enjoy it. So it's my privilege, and I think the majority of this hospital feel the same. It's our privilege to take care of those people.
I'm Joanne Baird. I'm an orthopedic surgeon specializing in sports medicine. I was an athlete my entire life, growing up in the Northeast in Jersey. Primarily a soccer player, played Division I college soccer. So I was always drawn to sports and the active kind of staying healthy, staying active, like interacting with people and seeing that I can make a difference. It's a very big growing area with a vast array. I mean, we've got a lot of kids and youth athletes in the area. I cover Alberta for football and their sports, and have absolutely loved my time there for the last I think it's been 4 years. The community also, we have a lot of retirees and people that are coming south to retire and live in a warmer area with beautiful beaches. And so as an orthopedic surgeon, being able to not only restore athletes back to the playing field and keeping them healthy and avoiding injury, which is a huge part of what we do too, injury prevention, but also being able to restore lives when they wear out their joints and have arthritis, and being able to do a total joint and have them walking that day of surgery and getting their lifestyle back to stay active.
The new tower has really brought us to the level, not just the bricks and mortar. That's not really what makes a hospital great. Really, it's the people that are serving and working within. But the new tower certainly brings a lot of just newness, a lot of growth opportunity. We have a new OR area that the operating rooms are extremely large, so we can accommodate any up and coming equipment or any new advances that they make as far as robotic surgery. And we do a lot of robotic assisted joint replacement. But I just think the continuity of our team, the team approach that we have here really sets us apart. But now we certainly have the facility and the bricks and mortar to bring it to the next level when that time comes. We're ready for the future here at Baldwin Health.